Hi, everyone. Today, I am super thrilled to be with Dr. Melillo, who is a university professor, a brain researcher, radio and TV host. He's actually one of the most respected specialists in childhood neurological disorders in America, co-founder of 150 brain balance centers, has taught over 7,000 professionals the Melillo approach, which is what we're going to be talking about today in our live. He's president of the International Association of Functional Neurology and Rehabilitation, which I presented at last year in Phoenix, Arizona. Best-selling author, has published 4 books, my personal favorites being Disconnected Kids and Reconnecting Kids, and he is coming to Montreal on May 4th and 5th. Dr. Melillo, welcome.
Well, thank you very much. I'm really happy to be here, and I can't wait to come to Montreal. It's one of my favorite cities in the world.
Yeah, and hopefully it's going to be, well, you know, in the month of May, it's beautiful weather, so at least you'll be able to run away from the snow that we can, well, not really see behind me, but that's definitely behind me. So I'm fascinated by your work, and I was completely blown away at the talk that you gave at Harvard last year at the Movement Is conference. And as you know, and as we've discussed in the past, Posturepro has been using primitive reflexes in conjunction with what we do, which is postural recalibration, for the last 5 years. The results that I've seen myself personally, clinically, and that I've been seeing with conditions like learning disabilities, movement disorders, Parkinson's disease, hand-eye coordination, sports performance, have been, to say the least, nothing less than spectacular. After hearing you talk and hearing you how you describe where these problems or the true cause of where these conditions originate from, I knew that I had to bring you down to Montreal. So for the viewers that are watching us that are kind of new to this approach, can you tell us about your brain centers and what is it that you specialize in?
Well, I think that, you know, one of the things that we were both at that conference at Harvard, because I was one of the keynote speakers for a conference called Movement and Cognition, right? So I know that a lot of the people that might be seeing this are more in the movement world or in the motor sensory world. And so right off the bat, sometimes it's hard for people to understand, well, what does movement or motor or posture, or what does that have to do with cognitive issues like ADHD or autism or schizophrenia or any of those issues, or learning disabilities like dyslexia? And when you really understand it, you realize that it has everything to do with it, that it is that brain development, which is really what I like to look at. What I do is what I call developmental functional neurology. It's not pediatric neurology, because the fact is we all have a brain that develops for a large part of our life. And what happens during those early years, probably the first 6 years, really determines a lot of what's going to happen with our brain. And some of those issues may not manifest until much later, even in 20s or 30s. But yet we know they go back to early development. So that what we know is that in psychology and neuropsychology, in psychiatry right now, in the mental health world, in the learning disability world, almost everything now is being looked at as developmental in nature. These are not generally things that happen later on in life for the most part, but especially if they have a neurological basis, not just purely, you know, psychological trauma or something like that. And so they start early on. So the question is, how do you identify these? What is it related to? And how can you intervene early in life or at any point in life to be able to change the course of brain development and therefore the course of the way someone behaves and functions and thinks and acts? And so this is where looking at early motor development is more and more becoming the key. And not just early motor development, but motor development and postural development in general is something that is foundational to the development of the brain, and cognitive skills are built on top of those. So if anything alters movement development and sensory processing at any point in development, especially in those first 6 years, it creates a developmental imbalance between networks in the brain, which affects their ability to communicate and integrate, and especially between the two hemispheres. And in my work, this is the basis of everything, of every neurobehavioral disorder, of almost every psychiatric, psychological or learning issue. And because the brain controls everything, it also has an impact on our autonomic system, our endocrine system, our gut, our immune system. So we can get dysregulation of every system in the body. And this is what we see. You see a kid with autism, or you see an adult with autism, and they not only have, cognitive, brain, mental issues, but they have a whole host of other health-related issues. Same thing with ADHD. And I mean, there was just a recent study that came out by Russell Barkley showing that people that have ADHD into adolescence, they generally die 10 to 13 years earlier and have a much lower quality of life.
Wow.
So, these are big issues. And again, it all starts with looking at motor development and motor function. And the primary thing you're looking at is primitive reflexes.
So I think when we say motor function, again, for the listeners, I'm always trying to put myself in their position. Primitive reflexes, can you explain in your own words for the ones that are tuning in, what is a primitive reflex and why is it important?
Yeah, and I think that's important because even when I was first learning about primitive reflexes and trying to look at research, and I'm a researcher, so I like to look at details and I like explanations. No one was really explaining, what primitive reflexes really were all about. And in the area of primitive reflex, by the way, there's some controversy, and the controversy is not whether there is something called primitive reflexes, but whether they automatically go away 100% of the time within the first year of life, right? And that is where the debate is. So what are primitive reflexes? The brain, when we're born, we don't really have much of a brain yet, right? We only have about 25% of the brain there by weight. And so the brain needs to grow. What promotes growth of the brain is when the baby comes out of the womb, because if it grows too soon, the head will never get out, right? Because as humans, we have the smallest birth canal and the biggest brain. So, that's a challenge. So that the genes that regulate brain growth and development are kind of waiting for a signal that they're outside of the body to really start growing like crazy. And so these genes that regulate brain development are what we call experience-dependent genes, that they are stimulated by environmental stimuli like light and sound and movement and gravity and temperature and touch and all of those things. So when we're born, we don't really have much of a brain. We have all the brain cells we're going to have, but the brain itself is very small. But yet in the first 3 years, it then grows to 90% of the adult size. So since these genes that regulate brain development are stimulated by sensory input, essentially, two things need to happen. One is to cause the brain to really grow, we need to move. Movement is what initiates engagement of our senses. So when we move and interact with our environment and we engage our senses, especially motor and muscle feedback, which is the main source of stimulation to the brain during development and throughout our life, we have to move first. But we don't have a frontal lobe really, and we don't have a motor cortex yet. So how are we going to move when we don't have a motor cortex to move us? And that's where primitive reflexes come in. We're born with these reflexes that are in the brainstem at different levels of the brainstem that will automatically, reflexively react and move and engage our senses to allow us to do things like root and suck so that a baby can feed themselves, or grasping reflexes, or startle responses to, orient themselves or alert them, or vestibular reflexes or neck reflexes that allow them to automatically move their body just by turning the head when they don't have a brain to really regulate it yet. So these reflexes are critical because they allow us to engage the world, which allows us to engage our senses, and then those stimuli come back and they turn on those genes. and they build the brain from the bottom up. So the first reflexes come from the bottom of the brainstem, the medulla. They allow for very basic reflexes, and then that engages senses, which then builds the next layer, and then that comes down and inhibits the layer below and releases more sophisticated reflexes, which then builds the next layer. And so like a cake, the brain builds from the bottom up, and eventually primitive reflexes are replaced by postural reflexes, which eventually allow us to stand up and move and be bipedal and do more complex types of movements. And then eventually all of that is controlled by the brain and the frontal lobe, so that the brain builds from the bottom up, and then it comes from the top down, and it regulates everything, if it builds from the bottom up the way it's supposed to. So this is what primitive reflexes are. This is where they come from. This is the purpose of them. This is how they become inhibited. And typically the last primitive reflex, which is on the bottom of the feet, which is called the Babinski response, goes away at exactly 12 months. And then when it goes away at exactly 12 months, that's when a child should walk. And so the controversy is that pediatricians, pediatric neurologists, they all know that primitive reflexes exist. They're part of a normal pediatric neurology exam and have been for decades. The question is, they assume that these reflexes automatically go away 100% of the time, and the only time they don't is if there's a brain injury or cerebral palsy. And that's where the controversy is, and anybody that's worked with these reflexes realizes that many times they don't go away, and that means something.
So when you say that many times they don't go away, this is, well, first of all, I have so many questions in my head, I don't even know where to begin. For mothers or healthcare professionals or young parents, what could they look for? What would be an indication that there is a primitive reflex that is not integrated with their child?
Right. So this is really important, because I think that this is where we miss the boat. And almost anybody in development misses the boat. So for instance, I just spoke with a family from Abu Dhabi today, and they were concerned about their son. And although he wasn't walking until 18 or 19 months, which is very, very late by my standard, they had no idea that he had a problem until he wasn't speaking at 3, right? So it's like, we wait until they're not actually speaking. Then I went back and said, well, okay, what was the first thing we could have noticed? And the first thing I asked her was, did he have any trouble latching on, right, as a baby for breastfeeding? And she said, yes, he couldn't latch on. He couldn't form a seal. Now that is an indication that there's usually low muscle tone, and that is the rooting and sucking reflex. And if that's not there from the beginning, that's a motor reflex, one of the most earliest and basic reflexes. And right there, we know that there's a potential problem. And I can tell you that almost every kid that I work with, there's something in those developmental milestones. They don't roll over at 3 to 5 months, or they roll over to one side but not the other, or they don't crawl in a normal way. They drag their leg, or they can't sit up at 6 months, or they fall over, or, they don't crawl at all. They walk too early, or they end up walking very late. And if they walk late, they're going to speak late. It's just, these are the way it goes. So what those milestones, those motor milestones, are very important. And they mean something. They're there. They represent normal human development. And when they're not there, it means something. But yet most people, and I've had many mothers say to me, they give you this book and it says all the developmental milestones. And when they don't hit the milestones, you go back to them and say, they didn't hit the milestones. And they say, well, don't worry about it. Right? So it's like, then why do they even give us the milestones if they don't mean anything, right? And it's really just that they don't know what to do about it. They don't know what it means. So they find it easier to try to not, alarm the parent when really, we could intervene at 6 months or 8 months or 1 year and completely change the trajectory of that child's brain development and probably prevent all of these other issues that could come about after that.
How can we intervene? I know that the listeners are going to say, what can I do? I'm thinking of so many friends just off the top of my head that are describing exactly the problem that you just described. The baby has a hard time latching on, and they're just associating it. They don't realize the consequences that this can have later on in life.
Right.
So what can you do as a parent, a new parent, to ensure that your baby is able to latch on? Can you give us an example?
Well, I mean, the idea is that if they're not able to have if they don't have the primitive reflexes, or they don't have the proper tone, it usually signifies a couple of things. The main thing it signifies to me is that there's already a developmental imbalance that started in the womb. And we believe that most of the issues like ADHD and autism and OCD and schizophrenia, which may not show up until somebody's in their 20s, it starts in the womb, and that these children may come out and already show signs of a brain developmental delay and imbalance. Ultimately, being able to, stimulate the reflexes and have good muscle tone. Muscle tone is a reflection of maturity of the brain and areas of the brain that control it. So there's two things. One is, with the reflex, the first thing we want to do is stimulate it more to make it come out, and then keep on stimulating it until it goes away.
Right.
In older children and in adults, there are specific activities or exercises that we usually prescribe or will teach them that reproduce the movements. And this is good because when someone's doing this voluntarily and they're actually doing these actions themselves, it's a very powerful stimulus, right? Because they're engaging everything. But in young children, or in children, like I work with a lot of severe children with autism that are nonverbal, that are young, or with babies, they can't do exercises. So what do you do? So I teach the parents how to stimulate those reflexes on their own, and do this 2 or 3 times a day, 7 days a week, until everything proceeds normally. And usually if you do it and you're diligent and you do it at a high frequency, and somebody knows how to show you how to do it, it's very effective on bringing on the reflex properly. And along with that reflex usually comes the muscle tone, and usually comes the balance of coordination. And then if you use it enough, then you will inhibit it, and then you will move on to the next stage. Otherwise, what I found is that if these primitive reflexes don't become inhibited and integrated within that first year, they never do. But they can be integrated at any point. I mean, I have videos, so many videos of adults with, very significant primitive reflexes, and within a short period of time, we're able to get rid of them or integrate them. And it's life-changing. I mean, it completely changes issues that they've struggled with their whole life. So it's very powerful. And I'm looking forward to it, because usually when we do a hands-on seminar like this will be, one of the things we're going to do is we're going to show people how to actually really look at these primitive reflexes. And I have to say that I think 2 things, and I'm not trying to sound not putting down anybody else or trying to pump myself up, but I have to say that most of the time I have a lot of people that have been through other primitive reflex courses. And I have to say that most of the time I feel like they're not trained very well. They're not really testing these reflexes the right way. They really don't understand exactly what to do. And therefore, if you're not testing them right from the very beginning, you don't see them. And that's a big issue. And how to get rid of them is also very important.
And in the seminar, of course, you'll be teaching. The seminar is welcome, by the way, for you guys that are joining us. The seminar welcomes parents, healthcare professionals, osteopaths, chiropractors, anyone that's really interested in optimizing the function of the body. So going back to that seminar on May 4th and 5th, we'll be going through those primitive reflexes and what to look for and how to test them and how to correct them.
Yes. The two most basic things that is part of my work, which I think is the most important thing that can be done in any of these issues. And really, like I said, it speaks to many different, whether people are suffering from back pain when they're older, because it really is probably a postural muscle imbalance, which also represents usually an imbalance in the brain, or whether it's depression, or whether it's, some other more severe mental health issue or a learning challenge. The two most important things are to look at these primitive reflexes and be able to get rid of them, and then to understand and identify if there is a developmental imbalance in the brain, which hemisphere is underdeveloped, which hemisphere is overdeveloped, and to then come up with a plan to stimulate the underactive side and to do that in the right way. So, and when you do those two things in combination, the results are just absolutely like nothing else that anybody has ever seen out there. And it really is incredible. And again, remember that when we look at, this is what I developed with Brain Balance, and that is really with kids, and those are kids that are pretty high functioning. So it is a limited, we're not working with younger kids and babies and kids that are severely, nonverbal. We're not working with adults. Those are people that I work a lot with in my own private practice. But, we've worked with, over 30,000 kids, I think, in the last 10 years. And we have like a 95% success rate. And this has been, really well documented. So, this is, and that's not to mention that I've worked with thousands of patients on my own, as well as you said, I've trained, many thousands of health professionals and doctors around the world.
That is extremely impressive. 30,000 kids. So what is so you're saying that these primitive reflexes, I know this because I do see this in my practice, but I'd like to hear your opinion. What would be the consequences for an adult, for example, that still has these primitive reflexes that are active? Would they have already a postural imbalance? At Posturepro, what we look for is a lower shoulder, a lower hip, a rotated shoulder, and then, we're kind of, because we work a lot with athletes that are loading it on and then trying to squat with this postural imbalance. A postural imbalance, the way that we see it, is a brain imbalance to begin with.
Absolutely.
So what would be some of the symptoms that you feel that adults might be going through if they have an active primitive reflex? Yeah.
Well, first I have to say, when I first experienced adults with primitive reflexes, it blew me away. And I understand how people feel at my course when they see this. So 20 plus years ago, when I was really just starting to teach about my work and looking at hemispheric imbalances and developmental imbalances, not only did I come up with the concept that there was this hemispheric imbalance, but then the question was why? Where does that come from? And I, speculated early on that there was some sort of developmental imbalance or developmental asynchrony between the two hemispheres. And so then the question was, why does that happen? Like, what do you see from that? So I started looking at other things that could look at development. And I was also very much into motor development and postural development. I'd already written my textbook. My textbook is called Neurobehavioral Disorders of Childhood, an Evolutionary Perspective. And it starts up from the very beginning of, where did brains develop on the planet? I mean, why did brains develop? And, it is very clear that brains develop because a living thing moved. That movement is what created brains in the first place, and movement is what creates brains in children. So understanding that, and so then I came across some work and literature with people talking about primitive reflexes and its relationship to autism and ADHD, and looking at things like cross crawl patterns, going back to Doman and Delicato in like the 50s. And so I started looking at primitive reflexes, and I started looking at them in children. And I started finding that they were still there in the children and the kids that I was working with. So then I started teaching, and I wanted to bring this into my courses, and I was teaching doctors about this. And I wanted to teach them how to look at primitive reflexes, but I didn't have kids to show them. So I just said, okay, well, let's look at it on one another. And what I found was that there was a person in the class that had all of the primitive reflexes textbook, like what you would see in an infant. And there were about 30 or 40% of the audience had at least one or two or three of these reflexes very clearly there. And I was shocked. So the first thing I did was I said, okay, well, what does this mean? So I started asking them about their development. I said, you know, did you have an issue as a kid? Now, mind you, these are people that are MDs, DCs, OT, PTs, very well educated, very bright people, PhDs. So they're, you know, they're not somebody that you think would have some sort of developmental disability or so. But when I went and asked them, they all did. And they all would say that usually they either had ADHD as a kid, or they felt like they probably should have been diagnosed with it. They, you know, had multiple symptoms. Most of them still have chronic digestive issues, chronic anxiety feelings, social problems. And usually it falls, like we see in most patient populations, in one or of two categories, depending on whether the right brain is delayed and the left brain is hyperactive, or vice versa. If there's a right brain delay, they usually complain of ADHD-like symptoms, or even autism-like symptoms, social problems, chronic anxiety, anger management issues, you know, problems with clumsiness, awkward. They, you know, may have problems with just generally reading people and reading situations, but they're usually exceptional at early academics, at math, at science. They have great memories for details. You know, their left brain is exceptionally strong. And then if they have a left brain delay and they have a right brain that's too strong, they usually have a chronic history of dyslexia and, you know, reading problems and learning disabilities and poor reading. But they're usually incredibly creative, great at reading people and situations, you know, very intuitive. And so these people that have made it to the point where they have a degree and are taking my course have found ways to compensate for their deficits. But what I found is that they all still had those deficits. And it didn't just usually impact their cognitive ability. It affected their motor ability. They would have, you know, they would have back pain, neck pain, headaches, oculomotor issues, vestibular imbalances, vertigo, motion sickness, digestive problems, hormone problems. You know, it impacted their whole body. But again, you know, they've been seen by many, many different doctors in many different fields, and even, but yet these primitive reflexes are still there and are still affecting them. And just by activating one side of the brain over the other, we usually can immediately get rid of these and their symptoms. And then by doing the other side, we can bring them back. And this is something we will do in this seminar. I guarantee you that 30 or 40% of the audience, you know, will probably have some primitive reflexes. And we will be able to have probably one or two people there that have all of them textbook. And we will be able to show how we can change that. And anybody can do this. So it's really something that a parent can be trained to do it. Anybody from any degree. And it's amazing that pediatricians and pediatric neurologists don't know this and don't do this as part of their routine. But hopefully we can influence that down the road.
Now, as far as doing the, like, what is the investment, time investment that someone will have to put in to retrain those reflexes? Is this something that's going to cost 35 minutes of my time every day? Is this something that could be done in a minute, in 5 minutes per day? Yeah.
It depends on the severity. It depends on, you know, when we look at reflexes, there are 8 or 9 primary reflexes that I look at. And I know that there are a lot more reflexes. I mean, there's 30, 40 of them at least. Quite honestly, I think, you know, I've looked at all of those and used all of them. And I find that I think most people that teach primitive reflexes make it too complex. They teach too many reflexes, and many of those reflexes, I don't think they're secondary. And the reflexes that I teach are the ones that are pretty standard in pediatric neurology when you look at them. And so, looking at those reflexes, it depends on, we look at how many they have, and we usually grade them from 0 to 4. So we look at their severity. So looking at how many they have and how severe they are will make a difference. How, where we're looking at this child, are they a nonverbal autistic child? Are they under the age of, 2 and can't do exercises on their own? Are they a full-grown adult who can do many different activities or exercises on their own? So it does vary. I will say that frequency is the key, that doing them. So let's say someone who's a parent with a nonverbal autistic child, we usually recommend doing, stimulating these 8 reflexes anywhere from 1 to 3 times a day, every day. They only take a few seconds or 30 seconds or a minute to stimulate them. So it may only take a few minutes to do this. But then we usually add some sensory stimulation as well, which again, usually it's a few minutes. So overall, we're looking at probably 10, 15, 20 minutes worth of activities, but we'd like to do this multiple times throughout the day or spread them throughout the day. If it's an adult that can do exercises on their own, once a day is usually what we recommend. And again, it's usually anywhere from 10, 15, 20 minutes worth of activities or exercises that they would do. And what I have found is that doing hemispheric directed stimulation along with the primitive reflex activities or exercises is by far the quickest way. It gets rid of the reflex much quicker than if you're not looking at understanding the idea of hemispheric imbalances and addressing that at the same time. It's a huge difference.
So I've seen you work and perform these tests and corrective exercises on different on a specific student in a video that I caught online of you doing it. Can we expect the results to be as fast? I mean, is it something that is noticeable in the session for some? And I understand it depends again on the severity, but is it noticeable within the session, for example, to notice significant changes in the integration of those reflexes?
Yes, usually. And it depends on, again, the age. I find that adults who have these reflexes their whole life, and if they're pretty dramatic, you can really use them as a great indicator. Like, for instance, if I stimulate the wrong side of the brain, those reflexes will get worse. If I stimulate the correct side of the brain, I can usually get rid of them immediately. And then I can usually bring them back again. So this is a way that we can use as an indicator to really identify. And also, we can try different modalities. So if you've seen me, I might try using sensory stimulation like light, and then maybe sound, and maybe vestibular stimulation, and maybe smell, maybe different colors, maybe movement or motor feedback. Vibration, electrical stimulation. I experiment with different types of modalities and different combinations, and it's pretty unique. You see that one modality with one person may work dramatically, and then another modality may not, even if it's done to the correct side of the brain. So that it gives you an idea also how long you have to use them for, what the frequency you need to use them. So in many people, these reflexes can be used as a direct indicator right then and there. Now, even though we usually get rid of them quickly in the session, they usually come back. And so we need to do this repetitively. And it usually takes at least a few weeks and maybe a couple of months to completely eliminate all the reflexes. But you can see dramatic changes in the session itself. And that is something that can really also be helpful from a diagnostic standpoint. In children, you can as well, but it may not be as obvious, some of the signs when you're doing it. But certainly you can often see changes when you start adding different modalities.
And are the sensation or for an adult, would they feel the benefits inside themselves? Let's say they're anxious or they have digestive issues. With these benefits, is this something that they would feel almost instantly?
Yes. And I'm going to show plenty of videos of this because I know that I know that many
I can't wait.
I know that many people are probably sitting there going, I don't believe this is impossible. I can't imagine. How could you? I've been trained in primitive reflexes and it takes months or it takes a year or, I've never seen anything that quick. It blows people away when they see this. And I completely understand it because it blew me away when I saw it. I just lectured in Paris about 3 weeks ago. And there was this woman, this doctor that was there from Israel. And she, very bright woman and, never thought that she had any major issues, but she struggled with certain things her whole life. But she really minimized it because she was there really talking about her son who had kind of like ADHD type symptoms. And she was saying, he's a lot like me when I was a kid. And so then we started testing primitive reflexes. And oh my God, this woman had crazy, like you could not believe, one of the most severe I'd ever seen, especially the TLR. She started to break out in a sweat, like as we started testing these things on her. And she had no idea her whole life that she had any of these, but she struggled with many things that she worked with, psychologically, emotionally, physically. But she thought she had kind of a handle on all of it. And, then we looked at her son and her son had a similar profile with primitive reflexes. So this is something that I know is almost sounds unbelievable. I have many videos that I will show and it will blow people away, but then we will also see it live. You'll see that. I guarantee you we'll see it in the audience. I've never had an audience of a decent amount of people where we didn't have this. And it's shocking, especially when you find it on yourself. And what you'll see in the videos is that many of these people, immediately you see the changes in their breathing, or you see their heart rate, or they tell me, I'm getting really anxious right now as you're doing that. Or they'll say, all of a sudden, I just felt this anxiety go away. And I've even had people tell me, I didn't even realize I was anxious. This is something I've had my whole life. And now it's the first time. I remember I had one woman that was standing next to me. She was pushing her toes into the ground. And she was saying, I can actually push my feet into the ground. I never realized I couldn't do that, and then you can see that we bring it back. You'll see videos where stimulating the correct side of the brain, their breathing changes, they relax. You see their face, doesn't flush. And then all of a sudden you do the other side. And in a short period of time, you see their breathing change. You see their anxiety. You see it in their face, or you see them, start their face flushes. It's really remarkable.
Yeah, and I think for the viewers, the reason being, and of course you're the expert that can explain this, primitive reflexes are connected to our autonomic system, right? The left brain and the right brain. So for some of us that have these reflexes, or our children that are still active, it's tapping into our fight and flight response. So basically our brain is constantly thinking that there's a lion in the room, right? I think that being able to identify those reflexes that are obviously still active with ourselves, with our kids, with our family, with our friends is definitely the way to go. Last but not least, it's something that sounds unbelievable. I know it does. We get the same reactions in our training program. In your words, in your experience, why do you think that this is still fairly unknown with doctors or the medical world or healthcare practitioners? Because I think it would make everybody's life and job easier if a doctor said, hey, go get tested for primitive reflexes, or have, this is something that's still fairly unknown. Why do you think that is?
Well, there's a number of reasons, I think. Fortunately, what I will say is that's changing. Last year, I was approached by a company called Vine Education, which was then also merged with a company called PESI. And they claim to be the largest continuing education company in the world in the mental health, rehab, and behavioral world. So this is mainstream mental health. This is psychologists, OTs, PTs, speech therapists, behavioral therapists. And they approached me because they said that many of their people were asking for courses on primitive reflexes. and they did research. They came across my work. They said, what you're doing seems really innovative and you're out there. And they partly found me because an organization called CHAD, I don't know if you ever heard of CHAD, it's the largest organization for adult and childhood ADHD. And it's a very conservative mainstream medicine organization. In fact, 85% of their initial funding and even ongoing funding, I think, is provided by pharmaceutical companies. And for years, they wouldn't let anybody talk or they wouldn't talk about anything but medication or behavioral intervention. And recently that's changed. I've lectured for them a couple of times, but they did an actual article in their magazine called Adhd magazine about primitive reflexes and its relationship to ADHD, and they interviewed me for that. And so what you see is, and I actually put a course together, and I lectured in 9 cities over last year to many mental health professionals, and they loved it. Very similar to what we're going to present. So that is changing, but why isn't it better known? And I would say one is, I find that in general, most people almost nobody understands the brain, how it works and how it develops. I mean, the first question I usually ask any audience is, who can actually tell me what ADHD is or what autism is or what is actually happening in the brain? And very few clinicians can even come close to even venturing an answer whatsoever. So I don't think, and I think a lot of people, they automatically assume that a lot of these things are caused by genetic mutations and there's nothing you can do about it. And we're told that there's nothing you can do about it. And we're told that these are lifelong issues. I also think that pediatricians and pediatric neurologists, even though they know about primitive reflexes, they never look at them beyond infancy. So if you never look at them beyond infancy, you never see them. And so you assume they're not there. And that's the conversation that I have, is I usually ask them, do you see kids with developmental disabilities? Yes. Do you ever notice that they have persistent reflexes? No. And do you ever look? No. So is it possible that they're not there? And they usually say, no, I don't believe it is. And I said, well, how do you know that? And they said, well, because they're only there during infancy. And I say, well, what if they're not there during infancy? And they say, well, I've never seen that. And I say, well, have you ever looked beyond infancy? And they say, no. So this is kind of the way the conversation goes. The bottom line is, I would venture to say, show me a pediatrician or a pediatric neurologist that has ever looked at looked for primitive reflexes beyond the first year. And I'll show you somebody who believes that primitive reflexes exist beyond there. But if you never look at them, and so, recently there was an article, an NPR article that was kind of a ridiculous kind of article that was done. And it was, again, the guy interviewed me and then went to a pediatrician. And the pediatrician said, well, you will never see primitive reflexes in anybody beyond 1 year unless they have cerebral palsy and unless they have brain injury. Now, I've written 2 pretty substantial papers on primitive reflexes. And I've done a study, which is the largest study ever done on over 2,000 subjects. And in the research, just in the research itself, if you go out there, it says that approximately 27% of the population is walking around, and the normal population has some primitive reflexes. So that's out there in the literature. But yet the average pediatrician or pediatric specialist is under that assumption. So I think that's the problem right now, is that there's lack of education and lack of understanding and lack of knowledge in really the brain and brain development and what these issues are. And I've spent most of my career trying to educate people, but I think things are changing, and I think seminars like this are really helpful. And I've had many pediatricians and pediatric neurologists that have taken my courses, and they come up to me and say, how come I didn't learn this? Like, how did I not learn this? And they go forward and of course they become a big proponent of it.
I love what you're saying. It truly is life-changing. We have a hashtag that we use at Posturepro called Changing Lives. And I think that this seminar will be nothing less than changing lives. For those of you that are watching, if you're a parent, if you have children, if you know people that have children, if you're struggling with coordination issues yourself, social problems, postural imbalances, if you've been told that you have ADD, dyslexia, dyspraxia, or simply a healthcare professional looking to add another tool in your toolbox, this is a seminar that you're not going to want to miss. Dr. Melillo, thank you so much. I think that I'll suggest for the viewers to, if you have any questions, to write them down in the comments below. I hope that you're going to be joining us on May 4th and May 5th in Montreal. The link of the registration will be put in the comments or in the description of the actual post. And we're going to be offering one free spot to a lucky winner. And all that you have to do is to basically share this video, this live video, with 3 of your friends. And the winner will be announced on April 31st. Not to mention that we have a special early bird registration that is ending on March 31st as well. Dr. Melillo, it was an absolute pleasure.
My pleasure too. One last thing I just want to add, if people are, again, hearing this and a little skeptical, all of my work is and all of these things like perimeter is currently been underway. There's a large study that's been done at Harvard Medical School, at McLean Hospital, the #1 mental institution in the United States. That study is almost complete, and it is showing changes in brain. I'll present some of that data. It's an independent study, but some of the preliminary data is available. And it is showing actual changes in the brain that have never been documented before in anything. And this is one of the leading labs in the world for ADHD and bipolar disorder. So again, this is real. It's substantial, and you know, there'll be all the scientific evidence to back it up. But most importantly, they're going to walk away with some really neat clinical tools that they can use the next day in their office, in their practice, or in their home.
Thank you so much. Thank you guys for watching. Thank you.
Bye.